Welcome to this unique presentation of Airway Epigenetics. This is going to be a short presentation followed by a panel of AMDs so that they can share their experience with you. And those of you who are watching this in replay, you can feel free to reach out to me at the end. All right, so we have epigenetics as our topic, and we have as our guests Dr. Geoff Laura from upstate New York, near Buffalo, and we have Dr. Laura from North Carolina, and Dr. Susan Kane from California. They've all been through AMD training or in the process of it, and they will chime in on what this has done for them in their personal life as well as professional practice. All right, so what's epigenetics, right? And well, the easiest way to understand epigenetics is to see it. And what you're seeing here is two faces of the same patient. It was a seminal case for me. And so what is epigenetics? Right? Epigenetics, according to CDC, is the study of how behavior and environment can affect gene expression. All right. So what you see before is gene expression. So you could say that when she came, and I'll tell you the story shortly, but when she came, her gene expression was maybe 51%. And here we can say her gene expression is probably closer to 90%. All right. Only God can bring out 100%, so we won't pretend to be that. But how do you get from here to here? All right. It's not a question of photoshopping this thing here. It's because we have this new idea called epigenetics. Okay. So, do you have neck pain, shoulder pain, back pain? Of course you do as a practicing dentist, right? And you have lots of patients who's also got these problems. They just don't know that there is a huge oral contribution to this, okay? So chances are when you're a childhood, you already have these issues. It's just that no dentist is trained to see impaired mouth syndrome as a airway mouth doctor. Okay, so let's dig into this thing called impaired mouth syndrome. So Newton's apple led to a discovery, gravity. Gravity eventually led to space travel. We can put men to the moon and back, okay? Well, it took me a career to figure out what impaired mouth syndrome is, but once you discover this, you will find that there are lots of solutions for what we call head scratcher cases, okay? So let's take a dentist, for example, okay? Here's a dentist, same person, 12 months apart, okay? The first one on the far left is Dr. Sylvia, who was pretty much in my class the next day. And the middle one is 3 months later, and the far right one is 12 months later. What happened, right? Well, here's what we did. The baseline symptom was whoops, this is a little slow here. Okay, so her baseline symptom was severe pain in the TMJ, despite acupuncture, massage, trigger point injections. She also suffered from pain, fatigue, and teeth grinding and restricted airway, okay? So dentists suffer from these things. They don't know the solution after coming out of dental school. So long story short, we gave her this appliance, and the details of the appliance is not important. I just want you to focus on the two ideas, impaired mouth syndrome right now and epigenetic solutions, okay? So in this case, we gave Dr. Sylvia this appliance and this bone building diet. So what can you say? It's fair, right? So Dr. Sylvia came with 9 symptoms. On a scale of 0 to 10, okay, she averaged about 8 or 7 or 6. Doesn't matter because everything improved over 10 weeks time, okay? So her jaw pain went from 8 to 2, sleep quality 8 to 1, right hip clicking 6 to 0, okay? So dental, medical, mixed, medical. All these medical dental symptoms, they all got better, so that over 10 weeks time, she went from 57 units of distress. All right, so on a scale 0 to 10, how much does jaw pain bother you? How much does your hip clicking bother you? How much does your sleep quality bother you? Okay, how much does your brain fog bother you? So 10 weeks later, we asked the same thing on the same baseline symptoms, and she came down to 11 for an 81% gain. So in a bar graph, this is what actually an impaired mouth contribution to the patient's symptoms looks like, okay? So undiagnosed, untreated, it's this bad. Once you diagnose it and treat it, it's this good. And none of this involves drugs, injections, or pain. So this leads me to the definition of impaired mouth syndrome. A syndrome is a collection of symptoms, okay? And impaired mouth structure could lead to a whole bunch of medical, dental, mood, and mental symptoms, okay? So we're going to show you next that everything improved better with more cases. So let's take an inventory. How many of these symptoms do you have? Actually, every one of these has got an oral contribution to it, okay? Because these are very common in bruxers. So this is where our panel is going to chime in. So when you become an airway mouth doctor, you will be able to solve these problems, okay? Crowded teeth, especially in the front, okay? And all the teeth grinding consequences, gingival recession, abractions, broken teeth, needing onlays, root canals, crowns, and chipped and worn incisal edges, okay? So once you get trained, you'll be able to do all of these things. The panelists that we have here, feel free to chime in on your own experience with this.
Well, I just started with this appliance about, 3 weeks ago, Monday. I had my first time turning the appliance this past Monday. It's comfortable. There is pressure to it. It's difficult to talk with, obviously. The appliance is here. So I sound a little funny, like Sylvester the cat. But I wear it. I usually wear it as soon as I'm done with patients. I start at about 4 o'clock in the afternoon, and I wear it until I start back up with patients at 7 in the morning, maybe quarter out for our morning huddle with the staff so they can understand me. But I can feel even with this, I will start next week, I believe, with the lower, but even with just the one, I begin to breathe better through my nose where it belongs rather than my mouth. So I've seen that just in my few weeks of wearing the appliance with just a little bit of activation.
Thank you.
Great.
So I want everybody who is in the audience to know this, okay? This is completely unrehearsed, okay? The reason why I call this a unique experience is because I don't know of no other airway residency or dental continuing education training program that ever invited the doctors who have taken the training to come back and share their experience with you. Okay, so part of our message that you can heal your own impaired mouse syndrome. Okay, part of message that we'll show you later that you're gonna be able to bring on the best facing children, and you'll get amazing career fulfillment. You become an unrivaled wellness resource in your community, and there's a viable path to get off the old drill and fill hamster wheel, which you didn't know you had signed up for when you got into dental school. And then like years later, you say, oh my God, how do I get off, right? Well, here's a wonderful way off. So Dr. Laura or Dr. Susan, would you want to chime in on any of these? Unscripted, unrehearsed, okay, but feel free to speak away.
Yeah, I started wearing my appliance in December, and I had very severe pain, but only later in the day it came on worse and worse, and I had tried everything, but
December is 5 months ago, right?
5 months ago, so yeah.
Okay. All right.
And I really feel like this has changed the quality of my life for the better. I feel like I have more energy. I feel like I'm back to my younger self. And I feel that I have a good understanding of how it works and how it feels. So I can always also communicate that to my new patients that are interested in it. So the little quirks that come up, you know, I can obviously relay that. But more importantly is I feel that it's just given me, like I said, a more expression of myself and my younger self. So, and in a way, I feel like it's made my muscles stronger. It's allowed me to, you know, be working out more, dancing more, doing all the things that I love more because I'm not in pain and because I have that energy and I'm sleeping better. So a lot of things come just when you're not in pain and you don't have inflammation and you are able to sleep well, which really this helps quite a bit, then I find that even that too helps to improve the quality of your life in so many ways.
Wonderful. All right. So again, unrehearsed. And this is what's amazing about this program. Okay. You get to heal yourself. That in a way that your dental school with education, your CE courses cannot and have not. Okay, Dr. Laura.
So I guess I'm the old timer in the group because I've had my appliance since August. And yeah. One of the first things that I noticed was that I have much better range of motion in my doctor arm, and I can put on shirts again, which is way cool because I've been in dentistry since '91. When I talk to my patients about how it feels, sometimes these are the same patients that I tell to do palatal distraction when they have a headache. So I say, put your thumbs in your mouth, push in and out. But I'll tell them, it's like, you know, that moment in the airplane when you finally yawn and your whole body just equalizes its pressure and says, thank you. That's what it feels like when I put this appliance in. It's just my whole head. And then my limbs are just like, thank you.
Wow. Okay.
And so, and some of the goals that I wanted to achieve, we're getting there. My singing voice is indeed improving. And I knew it had to. And I'm a little taller, Felix.
Okay.
Because I've been working on my tongue posture and my posture, because all of that is related. So as I'm doing the rest of the things, the myo and my diet, yeah.
Yes, great. So one of the points that you audience could begin to tease out of these AMDs experience is that personal experience of these AMDs is that the mouse is huge in your quality of life. And I'm not talking about cakes and ice creams and booze. I'm talking about your breathing, your alignment, your absence of pain, and your energy level. And best of all, this is my favorite, facial radiance in women. Every one of my patients comes back looking more beautiful if they're women. And if they're men, they say, I have more energy, I feel better. Yeah. So, do you have any comments or recommendation to people who wonder, well, why should I be bothered? I'm happy doing drilling and filling.
I do, because what I'm seeing just as I began to look at things, one of the things I found amazing, which I don't know if the other two ladies agree with me, is that I didn't really think there was a huge amount of need for this when I first began to look at it. And after just one visit down to Virginia, it was like, wow, most of my patients need this. If half the world's maxilla is retreated, then there's a huge a niche out there. This is cutting edge and no one's doing it for the most part. So like Dr. Felix says, we don't learn this in school. We don't learn it in our CEs. Our orthodontists don't know how to do it, and they should know how, because this is really what it is. But it really has made a difference. One of the things that, not to steal his thunder, Felix likes to say is ABC before D, and the A stands for alignment. And if you don't align teeth up, all that wonderful porcelain you may do to repair veneers and make those smiles will get destroyed if the impaired mouth is continue to go. If you restore somebody with crossbites, you're actually unethical. You're doing a disservice to that patient. And, you know, the nice thing is that you become a better healer, you know, better overall for patients' health. And they love it. I mean, I have a few people I've talked with on it, and I haven't started any with it. I'm looking forward to that. I don't think that Dr. Laura is that much of an old timer, but I'm glad that she's had some experience with it. And just going through Dr. Felix's cases, it's amazing to see what the capacity is. So it's always been there. It's just having the teacher come forward, and it'll teach you stuff that makes so much sense because you already know a lot of it. It's just putting all the pieces together. It's having, you know, that guidance to connect the dots as to why people are breaking down. And it really does begin in the mouth, in my opinion.
All right. So I would just like to share with you one more case that was really kind of like the seminal eye opener. Okay. I've always been interested in teeth grinding as a phenomenon, and it just kind of nagged at me ever since I got to dental school as an engineer. And then I just took courses everywhere and didn't find the answer until about 10 years ago. Okay. But the courses that I took, inside, outside dentistry, actually prepared me very well to discover this no man's land between the medical world and the dental world. Okay. So if you break a tooth, you go see the dentist. Everybody knows that. If you break a leg, you go see a medical doctor. Everybody knows that. But what happens when you have neck and shoulder or back pain that keeps coming back? Okay. What happens when you keep waking up from sleep and you don't feel refreshed? All right. You cannot keep sleeping and expect to get better if you have impaired mouth syndrome. All right. So here's a quick case. She was very inspirational to me. Okay. So she came at a perfect time. Here's the night guard that she ground through. And this is 3 years after braces had come off. So how can we do better? And if you are an orthodontist, or if you're a general dentist who does orthodontics, what didn't go right? And if you're a general dentist, you actually are in the best position to recognize this and do something about it, because this patient is suffering. Okay. So I talked to her about the possibility that, hey, we can get your tongue under control by managing your airway in a way that's meant to be, so that you do not have to breathe through your mouth. you do not have to thrust your tongue to open up your airway, you can actually feel better and look better. And the way you do that is by, one, changing the diet. She was 17, she was eating a standard American diet, fast food, processed food, you know, out of a box, package, doesn't matter. So we did our homework. We figured out her maxilla was too narrow. Her mandible was actually okay. We also figured out her maxilla was way retruded. Retruded is the opposite of protruded, okay? So that's the reason why she has a choked airway. And that's why she was bruxing, very simply. So just a few slides to show you what happened. Her posture straightened once we put this into her mouth to change the oral environment. And as her maxilla grew, guess what? Her anterior open bite closed spontaneously. No braces, okay? So here's what happened. I think 4 or 5 years later, and this is a comparison of pre and post. We actually tripled her airway volume, and we multiplied her minimal cross-sectional area, the narrowest part of her airway where airway collapses and apnea happens. And we actually multiplied that minimal cross-sectional area by 2.3 times. So as a result, she could sleep better. And guess what? Her gene can start expressing. Okay, so you can't do this with braces. You can't do this with night guards. You can't do this with CPAP. So what happened, and how can we take advantage of this and apply the principles embodied by this transformation to all the other patients, okay? So it's not night guard. We didn't give her another one. It's airway, and that's what made a difference. And this has, guess what? Implication in your general restorative dentistry, right? So if a tooth fails, you can offer them implants. What happens when your implants fail? Now what are you going to offer them, right? So this is where Dr. Geoff was talking about ABC before D. That stands for alignment, breathing, circulation before dentistry. You're a good student, Dr. Geoff.
It was an aha moment.
Yeah. See, so you know, when someone's got all of this restorative dentistry done with this kind of airway, and still the implant supported bridge fails, you got egg on your face. All right. And the bigger the case, the greater the legal risk. The patient's mad enough, even if one tooth fails, right? Okay. So night guard is a Band-Aid. The real solution, if you're interested, your patient definitely want it, okay, is to fix their airway, not another night guard. But here's more important, okay? Epigenetics. When you grow the maxilla, you change everything, all right? Here's what happened. Look at the floor of the eye socket. It is part of the maxilla. It's a rooftop of maxilla. So when you grow the maxilla three-dimensionally, vertically and transverse and AP, the floor of the eye socket raises, okay? So let's look at the next slide here. Here's the same patient. She started out with the white sclera showing between the iris, the colorful part of the eye, and the eyelid. And then guess what? When we're done, no more. You can't do that with braces alone, okay? So this brings me back to this thing called epigenetics. Epigenetics is how behavior and environment can change gene expression. So we change her gene expression by changing her oral environment and asking her to change her diet. And we now can apply this to kids of all ages. And we don't do this because we give them an appliance. Sure we do, but the appliance is only part of the picture, right? The other part is a bone building diet. Because if you don't have that, you can't fix a stuffy nose. And if you have to breathe with your lips apart, not only will you have snoring, but you'll also have what? A long, narrow, and horsey face. So your maxilla is going to become more constricted. And that's what happened to the tennis player with a 17-year-old who came in with the anterior open back. She has stuffy nose, all right? So you must be able to solve this problem if you want this case to work out this well. This is a lawyer. She had a baby in between under my watch. I didn't have anything to do with it. It's just that, you know, she actually had a very easy childbirth and she looked more beautiful after delivering a baby because her airway got better and because her gene expression become fuller. Here's another mom. Here's pre-treatment on the left. Same person. 2 years later, she actually looked younger. So this is done readily by dentists who have been trained. This is Dr. Doris Perez of Vero Beach, Florida. And this is 1 year's difference in her office, okay? This is Dr. Kristen Lewis in Nashville, okay? This is her patient. Look at this, all right? So we have really wonderful opportunity. You don't have to be a Dr. Felix Leal to do this. As long as you get the training and have this whole health knowledge base all about this, then you can do it. Is it safe? Yes. We've done over 2,000 cases. We've had 0 tooth left. I mean, lost, 0 tooth lost to any appliance that we've used, okay? Needing root canal treatments, 0. Why? Because we're growing things. We're getting gene to express. We're bringing on fuller gene expression, better face. Anyone want to comment on this? Your personal experience with your pain, your sleep?
I'll comment a little bit.
Sure, please.
So I was saying that, you know, I had this terrible, terrible hip pain. And I also had this acid reflux. And those were my main concerns, also some sleep, but, you know, I just thought that was normal. But what was so striking was really within, you know, even a couple of days or weeks, you can notice an immediate improvement. And I was at the airport and I couldn't, when I was flying in to Virginia, I couldn't even walk through the airport without stopping, leaning over, getting onto the floor. And then when I went home after I had the appliance, I was taking the stairs. I didn't even need the escalator.
All right.
So it was that kind of thing that really was a very quick change in your symptoms. But, you know, they still are there. And of course, you're not wearing it 100% of the time. So there are small, more subtle improvements as time goes by. But I think that when patients feel immediate results, you know, how often can we give immediate results? Well, sometimes we can, but not like this, not really where you almost immediately, you're walking hunched over and you put it in your mouth. And I've seen patients that I put it in a construction bite in their mouths and literally immediately they're walking straighter, they're standing up straighter. Definitely in children, I saw in one case I've had an 8-year-old, I did some occlusal pads on him and I made him an appliance and he went from looking probably 6 years old to now in 3 months, he looks like a completely different kid. I mean, I would say he looks years older. well, he was 8 or 9 when we started, well, only a couple months ago, but none of his teeth had exfoliated. They were all ground down to the nubs, and he was breathing all the time through his mouth. His head posture is contorted. His tongue was moving all over the place. 3 months later, he's totally thriving. Like he now looks like he's 13, going from, looking like a tiny little baby to looking like a mature boy in 3 months wearing this appliance. It's unbelievable on children. I mean, adults, I think takes longer, but this kid is totally thriving now because he can breathe, and it has changed, his whole trajectory of his life. So that to me has been one of the parts. I never really treated children. I was always afraid, but Dr. Felix makes it himself very accessible. And that's where I feel the most, that we're really able to make a difference, obviously, is when kids are growing up and then you change the trajectory of their lives. And now I've done it probably also about 5 cases, and all of them are really, thriving so much more. It is really a beautiful thing to see.
Thank you. I see Dr. Laura nodding.
That sounds amazing. So I'm terrified of treating children as well. And I really have got to get our calendars together because I want to come to this class.
Sure. Sure.
That's what a gift that is.
Yeah. Actually, speaking of that, let me share it with you because like we got to show a couple parent children's cases. Okay, so let me just go back to one case here, and you see the transformation. And by the way, all you adults, AMDs on the panel, you all improve very quickly yourself, right? So this is about gene expression, and this has nothing to do with age, okay? Your gene wants to express itself, whatever your age is, because your body wants one thing, not only survival, but it wants to do better. It wants to be more efficient. It wants to waste less energy against gravity, okay? So this is one of the big light bulb moments in my career. Okay, when I read this study out of Stanford Medical Center, it says pediatric obstructive sleep apnea in non-obese children is a disorder of oral facial growth. Whoa. Okay, so the problem is what? Failure to thrive in the jaws. So this is our wheelhouse as airway mouth doctors. And here's what you can do knowing what that piece of research conclusion is, okay? This is 2 years. Same girl, you can turn an average duckling into a swan, okay? And guess what? She's gonna be all set for life in terms of PMS, in terms of childbirth difficulties, in terms of headache, moodiness. You wouldn't believe how productive she is. She's entering national debate competition, and she's training to become an opera singer. Yeah. Okay. So what happened to her was that this is her baseline symptoms. She woke up tired and rested. Okay. When she had braces put on, like all the teenagers, she got headache, she had trouble focusing on schoolwork, and her singing voice became strained, and she snored loudly, okay? Mother happened to be an AMD sitting in my class, and she said, oh, really? We maybe should consider doing a diagnostic workup the way AMDs is trained to do, which is to look at the oral cavity in 3 dimensions. So here is side to side, okay? So side to side, she's not in the minus because she grew up in a naturopathic doctor's office, home. So she had very good nutrition. But the problem is that the maxilla is still too small for the mandible in the molar region, okay? And so here is -5 in the vertical dimension of the oral cavity. Okay, in the AP, she's not bad. So her case become very easy to treat. So we gave her this appliance instead. She had her braces taken off, and mom put this in. And so in 10 months, she went from here to here and from here to here. This is gene expression, okay? Fast forward 2 years later, she looks like this. So what you said, she would have grown into this. No, I don't think so, okay? So here's the airway comparison, okay? We had a 50% gain in airway volume. We have almost 100% gain in minimal cross-sectional area. She went from 196 here to 389 here. That's 98% gain, okay? This is important for schoolwork. This is important for sopranos, okay? So Dr. Laura, you mentioned about your singing improving, okay? The less struggle you have in the pharyngeal muscles, the more relaxed they are, the better they can perform. So this is what she looks like now. No braces needed, okay? And here's a comparison of her baseline symptoms. So pre-treatment on a scale of 0 to 10, her sleep disruption was 8, snoring was 8, headache was 9, inability to focus was 10, vocal stress, singing is 9, fatigue was 10, okay? So out of 6 symptoms, she came in averaging 9 on all of these. Well, 20 weeks later, it's down to 11 from 54, okay? So that is a 43-point gain out of 54. And if you divide 43 into 54, you'll get an 80% gain, okay? So here is the great joy about this. Your children come in looking more beautiful. Your women come back in looking more beautiful. Guys have more energy. They feel happier. And you don't have to break your back and twist your neck and kill yourself, all right? I can easily double my practice volume without hurting myself twice as much, unlike the drill and fill practice, okay? And guess what? You get to heal yourself. And guess what? You get to, once you treat the airway, you're able to epigenetically, this is myself, by the way. My airway was in trouble before I saw the light and learned from my mentors, Dr. Singh among them. Thank you, Dr. Singh. So this is the airway that you want when you go into your retirement. You don't want to go into your retirement with this, all right? So all the AMDs, you're never trained to do this. We will train you on how to do this. And when you manage to do this on yourself, and we'll coach you how to do that, this is what my patient told me as having improved after getting this issue addressed. So I'll give you a few seconds to look at this. And this is the oral contributions, okay? So we never touch the patient on their pelvis. We never touch the patient below the shoulders. We treat oral contributions by doing our diagnostic work like this and design an appropriate appliance so that we can make this kind of difference and 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 this kind of difference. And all of this without causing yourself any pain, any fatigue, and any more degeneration, okay? So there's all this joy and there's all these benefits. Just real quick, if you know how to do this, this is my grandchild, okay? And she started like this. So how do we get there? Okay, this is what part of what we teach. Okay, we talked about the epigenetic essentials to grow airway in adults and best facing children. All right, there are certain things that must be in place. There are certain skill set and certain awareness that you AMDs must know in order to produce outcomes like this without braces. This could be your child, your grandchildren. This could be any patient in your practice, starting from here, and maybe even better yet, preconception. I teach that you should, as a young woman planning to have children, give yourself a year to let the airway mouth doctor help you. Get your own airway in order. Get your own head, jaw, neck, and pelvic alignment in order so that you would become a good incubator for this new baby, okay? So that's what we do. And so panelists, feel free to chime in, and then we'll bring this to a close. Anything you want to add?
So
Yes.
Felix, knowing what I know now about the relationship between, since you just talked about motherhood, so the relationship between the SI joints and the TMJ.
Oh, totally. Oh,
And
yeah.
I tell my patients all the time now that when your maxilla and your mandible are in the right position relative to each other, then your cranial base is going to sit on your spine in a whole different way.
Yes.
And yeah, it's
So
eye-opening.
So, you know, this is a great illustration of how the leg length is related to the dental midline. And when you bring the dental midlines together, the leg length becomes even. So the pelvis become less strained on one side versus the other, because the occlusal plane is part of bodily postural plane. But most of the patients come to us like this, totally off kilter, and nobody ever diagnosed them. All right. Anyone else want to chime in before we close?
I would just say that if anybody's doubting learning this aspect, that they're going to be left behind in dentistry the same way those who refused to stop doing amalgams. I stopped doing amalgams in 1989. And
Good for you.
my colleagues said I was nuts, and the insurance company said you can't do that, but I did anyways. And this is the answer to allow patients to have a full, healthy mouth where the restorative work we do doesn't get beat up. They don't have the medical issues that they have. They can heal from the ones they do have. I just don't see why anyone would want to use. I drive horse and carriage. I'm going to name my next two, thyroid and adrenal gland. But I love driving horse and carriage, but I sure as heck don't want to get around and drive down to Virginia from upstate New York in a horse and carriage. It's going to take me forever. So I'm going to stick with modern technology, and this is tomorrow's technology. So I just don't know why people wouldn't want to do it.
Thank you, Dr. Geoff. Anyone else? Dr. Laura or Dr. Susie?
Honestly, sir, I took the class because I wanted to treat myself.
Well, we always start there, right? You take care
Yeah.
of number one, and now,
And
like, once you get it, you can say, my God.
And honestly, I never wanted to consider treating airway patients before, because I thought all I could ever do is screw them up more by putting them into mandibular advancement. And once I found that there was a way I could actually fix them, that was huge.
Yeah, thank you. Yes, a lot of dentists don't know this because, you know, the earth just turned around in our profession. We've been living in the earth's flat world. Dr. Susie, any parting words of wisdom to share? Whoops, you're muted. You're muted.
I was going to say that it's a conformational change in the way that you open your eyes and look at patients. And you don't only look at what's going on the teeth, you're looking at what's going on in their whole health. And that is a beautiful thing, to be able to view people in their entirety holistically, rather than just be thought of as someone that puts teeth back together again or makes them straight. And it's a paradigm shift in the way that you think about practicing dentistry.
Yes, thank you. So I want to just share one thing. I click on the wrong window here. This is the one I want. I want to mention that one point to follow up on the one you just made. Think about, this is to all the AMDs, future AMDs, all the general dentists who are watching this replay. Think about the number of dentists around you who are doing implants, cosmetic dentistry, and bone grafts, and whatever you want to do to, you know, generate income in your practice. And think about how many there are around you who can deliver this kind of epigenetic airway and subsequent health and wellness naturally. Okay, so you become what I call the unrivaled wellness resource. Nobody can touch you. Okay, once you know this, you become the most valuable missing X factor answer for all the patient's problems. Every healthcare professional in your community need to look you up, and they would have, you know, head scratcher cases that says, now, what do I do with this patient now? Well, medical patients have dental symptoms and dental impairments, but they don't know, okay? Their doctors don't know. Dental patients have medical symptoms, and dentists don't know that the mouth is contributing to those medical symptoms. So there's a huge awareness and knowledge and skill set gap that we need to bridge. So that's why we invite those of you who are watching this replay to join us as airway mouth doctors. So thank you, all you panelists, for participating, and all you viewers of this replay, we invite you to contact us, and here's how you get in touch with me, right here. Thank you. And with that, I want to say my appreciation to Michael Hahn, Dr. Geoff, Dr. Laura, and Dr. Susie for showing up tonight to make this program possible.
Thank you, Dr. Felix.
Thanks for
Thank
having
you.
us.
Bye-bye.
Bye.
Thank you.
Bye now.